My name is Nikola Lekic. I am one of the orthopedic surgeons in South Florida Orthopedics. Although I do general orthopedics, all sorts of fracture works from the shoulder down to the hips, I have a keen interest in hand and upper extremity. So anything from the fingertips all the way up to the shoulder. Grew up in New York City, and I ended up going to Georgetown for medical school in Washington, D.C. And I made my way down to Miami, Florida for my orthopedic surgery residency. And that's the University of Miami, Jackson Memorial Hospital. It's their level 1 trauma center where we did all sorts of severe orthopedic trauma, everywhere from terrible pelvic fractures to hip fractures to shoulder and elbow, you name it. So I do general orthopedic surgery fracture work all over the body, but my interest really lies in hand and upper extremity. I moved to Houston, where I did a further subspecialty in hand and upper extremity surgery. I trained with hand surgeons, but half of them were orthopedic trained hand surgeons, and the other half were plastic surgery trained hand surgeons. What I learned how to do with the plastic surgeons was not only to make wounds look nice with their plastic surgery technique. So we used small incisions, we used careful wound closures to help make it less noticeable, the scars less noticeable. But in addition to that, we learned how to move tissues around. So for example, if you're missing a large area of tissue and muscle on the back of your forearm, for example, we can take some tissue from the front of your forearm and move it to the back of your forearm. I used to play a lot of soccer growing up, and I played soccer in high school where I tore my ACL, and so my orthopedic surgeon at the time, he got me very interested in orthopedics, and I had my ACL surgery reconstructed, and it went very well, and my doctor at the time asked if I'd be interested in shadowing him, and there was a silver lining in all of that, where my injury sort of got me to the path that I wanted to be, and so now running again, I'm playing soccer again, and my goal is to make my patients as happy as my orthopedic surgeon made me at that time. I'm excited to be here. Area over here is fantastic. Not to mention the fishing and the water and all the sun that Florida brings, but also the community here at South Florida Orthopedics. We have partners in all the different subspecialties, so any orthopedic injury that a patient might have, we'd be able to accommodate them and take care of them. We also have a wide array of ancillary services that patients can take care of all in the building, so they don't have to go to outside facilities. So one of the things that drew me towards this group in specific was the fact that we have our physical therapy and occupational therapy all right here. We have our x-ray machines here, so it's very convenient for patients. So rather than having to wait for an x-ray, we can get it done right here in the facility. Rather than trying to get a hold of therapists from an outside building, we can talk to them directly. So if a patient, for example, has a complex surgery, rather than calling them over the phone, waiting for a phone call back and maybe getting lost in communication there, we can just take a walk downstairs and talk to our therapist and tell them exactly what they need for our patients. And that's something I really appreciate about this group and this facility that we have. If you have any sort of orthopedic injury, but specifically if you have any sort of hand or upper extremity, elbow or shoulder injury, you can just call our office and tell them you're having some issue, and we can very quickly schedule you to see either me or one of my partners.